Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today is the Honorable John Hagee, Minister of Health and Community Services, and Dr. Roseanne Sevier, Acting Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
COVID update. So as usual, I'll turn things over to Dr. Sevier for today's numbers.
Good afternoon, and thanks for joining us here today. Since the last media advisory, we have 9 new confirmed cases of COVID-19 in Newfoundland and Labrador. 7 are in Eastern Health, 5 are under the age of 20 and contacts of a case. 1 is under the age of 20 and the source is currently under investigation. 1 is between the age of 20 and 39, and this is a contact of a case. 1 is in Central Health between the ages of 50 and 59 and is a contact of a case. And 1 is in Western Health between the ages of 50 and 59 and a contact of a case. There have been 10 new recoveries, 7 in Central Health, 2 in Eastern Health, and 1 in Western Health, leaving 46 active cases in the province. The total number of COVID-19 cases in our province is now 1,898. 5 people are hospitalized as a result of COVID-19. 1,062 tests were completed since yesterday for a total of 325,882 tests completed to date. I want to begin by offering my condolence to the family and friends of the 5 individuals who passed away since the last briefing. We are so sorry for your loss and thinking of you during this difficult time. The healthcare staff in the hospital and on the COVID-19 unit know that these numbers represent people who they have cared for with a face, a story, a family, and loved ones. Thank you to them for their hard work and dedication in caring for those who are seriously ill. No one sets out to get COVID-19. Getting a phone call from public health to tell you that you have had a positive test result is difficult for anyone to hear. Since the start of the pandemic in Newfoundland, 1,898 people have received that call. Please imagine yourself in their shoes and treat them as you would want to be treated. They need our support, our compassion, not judgment or contempt. Please, if you have even one symptom of COVID-19, book a test and self-isolate. Do not assume it is a cold. For anyone who has questions on the testing and isolation requirements for case and contacts, we have developed a new isolation guidance tool to assist. This is now available on the COVID-19 website under the heading Public Health Guidance. One of our greatest challenges right now is those who are eligible for a vaccine but have not yet been vaccinated. In our province, that is currently 76,000 people. Delta is not done with us yet, and it is like a fire that seeks out the dry grass. I'm deeply concerned for each and every one of you because I know how effective Delta is in doing its job when it encounters a person who has no immunity. Again this week, the national statistics indicate that unvaccinated individuals are 10 times more likely to get COVID-19 and 36 times more likely to be hospitalized with COVID-19. Studies show that vaccines are safe and continue to demonstrate high sustained efficacy against hospitalization and death, even with Delta. Our own experience in Newfoundland confirms this. In Newfoundland and Labrador, since late February, 83% of overall cases are among those not fully vaccinated. Almost 91% of cases who were hospitalized or died due to COVID-19 were not fully vaccinated. When we do see breakthrough cases with hospitalization or death, it is in those most at risk, such as the elderly or those who have other compromising health conditions. Starting tomorrow, there will be an update to the COVID-19 online hub. Vaccination status of cases and vaccination status of those with severe outcomes will be updated regularly. These statistics will be updated with a minimum of 10 new cases to protect individual privacy. Since September, Newfoundland and Labrador has been offering 3rd doses to individuals who are moderately to severely immunocompromised. People in this category require 3 doses to complete their primary series. I encourage anyone in this group to complete the primary series with a 3rd dose. Regional health authorities have started administering or are preparing to administer booster doses in long-term care and other congregate living settings for seniors. In accordance with guidance from the National Advisory Committee on Immunization, the booster dose is given 6 months after the 2nd dose. We are also pleased to announce that Pfizer has formally sought Health Canada's approval to administer the COVID-19 vaccine to those aged 5 to 11. As a next step, Canada's National Advisory Committee on Immunization will be giving guidance on pediatric vaccination for COVID-19. Vaccinating school-aged children will allow us to provide protection to this previously ineligible group. The province has already began planning and to prepare for this. As we continue to contend with COVID-19, we cannot forget our other viral nemesis, seasonal influenza. Last year, our province did not report any cases of influenza, which can be attributed to the public health measures that were in place during the fall and winter due to the COVID-19 pandemic. This year's restrictions have eased with respect to both travel and activities within the province. This is expected to impact the numbers of influenza cases in the province. This fall and winter, we will be running 2 vaccination campaigns concurrently for COVID-19 and influenza. More information will be coming in the next few days. Remember that the same layers of protection that we applied to prevent the spread of COVID-19 applies also to other respiratory viruses, such as influenza. Physical distancing, masking, hand washing, and staying home when we are sick are all effective ways for us to keep ourselves and our family healthy and safe. But vaccines are far and above the best tool in our fight against both viruses. In Newfoundland and Labrador, we have just over 91% of the population who are eligible for vaccination who have received 1 dose, and 84% who have received 2 doses. To those who remain unsure or reluctant about vaccination, please do not give Delta a chance. For anyone who is just joining us, we have 9 new confirmed cases of COVID-19 in our province, and we have 46 active cases. As Halloween is just over a week away, this is a good opportunity to remind those participating in trick-or-treating on how they can keep themselves and their neighbors safe. The most important thing to remember is that if you are feeling sick or if you are self-isolating for any reason, please do not give out treats. Put a sign on your door asking parents and children to skip your home. Please be respectful of all households not handing out treats this year. If you are handing out treats, please wash or sanitize your hands and wear a non-medical mask when opening the door. Drop the treats directly into the child's bag rather than inviting the children to select their own from a bowl. Children should stay at home if they are unwell. Children should wash their hands before they leave home, when they arrive home, and before eating any treats. Parents should consider accompanying their children to ensure they follow safe physical distancing guidelines. Children should avoid entering indoor porch areas when getting treats. While non-medical masks are not required for outdoor trick-or-treating, they are required in apartment buildings or other indoor spaces. Today will be my last media briefing, as Dr. Fitzgerald will be returning from her well-deserved break. I want to thank the amazing public health team in the department and those in the regional health authorities for their work and dedication as we tackle the 4th wave of COVID-19 in this province. I also wish to thank you, the media, for supporting getting these important messages out to the people of Newfoundland and Labrador. Be safe, be kind to one another, and get the shot. Thank you.
Thank you very much, Dr. Sevier, and I too would like to send my condolences to the family and friends of the recently deceased individuals. It's a sad time for them. Today, I want to address some comments towards the vaccine passport. That program rolls out, becomes mandatory at the end of this week, and I thought it would be helpful on this occasion to go through some questions that we have had in the department and through the regional health authorities. We do know some people have had some difficulty in getting their vaccine record because of errors. These, once reported, are being corrected, and there are staff in each regional health authority devoted to this task, and they're working hard to do it. There are numbers or emails for each of the regional health authorities, and they can be found on the COVID-19 website. We also know that there are people who received their out-of-province vaccination who are waiting for their record. The verification process with other jurisdictions is not seamless and has at least a 2-week period. So again, we appreciate your patience during that period. So if you don't have a QR code, the aftercare sheet and immunization record in this province, and this is an example from Eastern Health, is a document that shows what you had and when you had it, and is regarded by us as proof of vaccination for businesses, organisations and government bodies. People with out-of-province records will have got something similar from the jurisdiction where they received their shot. If you were vaccinated here and don't have a valid MCP, this record will do in its place. It's a document that we have regarded and will regard through this program as adequate proof of vaccination. Businesses and organisations must accept the aftercare sheet as a proof of vaccination. They need to review that to make sure that the dose for the second dose was at least 2 weeks prior to them attending your business. And all the other information that they need is to simply match the name on that form with that on the ID that you must also provide. Questions around ID have led us to alter our requirements for people age 19 and over. So if you are over 19, you've got two choices. You can have one piece of photo ID with name and date of birth, or two pieces of non-photo ID that include their name, so long as one of them has a date of birth on it. The identification requirements for 12 to 18-year-olds remain the same. That's one piece of non-photo ID with their name and date of birth. Photocopies or pictures on the phone are acceptable. The final question has been around medical exemptions. These are determined as a practice issue by the College of Physicians and Surgeons of Newfoundland and Labrador. They have provided thus far only two medical reasons: severe allergy or anaphylaxis to a previous dose or to a component of COVID-19, or a diagnosed episode of myocarditis or pericarditis after receipt of an mRNA vaccine. We have heard about mental health issues of some severity, and our mental health team are actually reaching out to the College of Physicians and Surgeons to have a discussion about what any changes to the guidelines they may feel are necessary in the light of these comments. But to get a medical exemption, you've got to visit a physician or a nurse practitioner. They will confirm whether you meet the approved criteria, and there will be a form provided with a letter stating that you have an approved medical exemption. For those with a valid MCP card, you will get a QR code later in November. In the interim, you can present that letter signed by your physician or nurse practitioner at a business where proof of vaccination is required. More details on when and how you can get your QR code will be available in the coming weeks. For those without a valid MCP card, you won't be getting a QR code at this time. You can continue to present the letter and that has to be accepted by organisations where proof of vaccination is required. One of the other comments I would make is that staff are working really hard to keep you safe and process these issues. I think kindness, respect and patience would be helpful when dealing with these individuals who have a significant workload. I'd like to thank those who have been in that position before for their tolerance when that sometimes hasn't been forthcoming. I'd like to just close out again by reiterating the best protection for each and every one of us is for everyone to get the shot. And I'd also like to take this opportunity to thank Dr. Sevier for once again stepping into the role as Acting Chief Medical Officer of Health to spell Dr. Fitzgerald for her well-deserved rest. I certainly appreciate all the hard work and effort that Dr. Sevier's put in over the last little while. So I think with that I'll close and turn it over to Leslie for questions. Thank you.
Thank you, Minister. We have two media in person and two joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask one question and one follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask one final question. Our first questions are from Jody Cook with NTV. Please go ahead and make your way to the mic.
Good afternoon. Our numbers here today, a number of them are under 20. Does this mean we're seeing a presence of COVID-19 in our schools, particularly in the Eastern Health Jurisdiction?
So at the moment, we have 4 schools that are impacted by a case within the school. We have a school in Marystown, We have Anthony Padden Elementary in Musgravetown, and we have Heritage Collegiate in Lethbridge and Bayview Academy in St. George's. So within those schools, there would be, a case, or there might be a second case within a class, and Public Health has reached out to those schools, and the school board has reached out to those schools, and they've and children are isolating and being tested.
On the MCP issue, we're hearing about a number of complications for people who have lost cards and have gone into the queue to try to get a new one, or just to simply need to, because their card is expired, and then not being able to download their vaccine passport. What's happening at MCP right now?
I think it, as a side note, re-emphasizes the importance of actually having a valid MCP card. I think a lot of people who don't have need for regular medical care have kind of got a little bit complacent about that. That aside, we do know that there are people who have long expired MCP cards, and so we've placed extra staff in MCP offices to help process the increase in volume. If your expiry is within 3 months, you can renew it online yourself.
Our next questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
I want to ask about, you touched on this in your preamble, Minister, but people who don't have an MCP card. Some other provinces have given them a unique number when they get their shot so that they could still go online and retrieve their own information. They qualify for the vaccine passport, especially since there are people who, for example, students who aren't able to get an MCP card because they're required to keep their original province health card. Why haven't we established some sort of unique number so that the vaccine passport and similar systems can be used by people who are vaccinated here, live here, but just don't have an MCP card?
That's a good question. We made a decision to use the paper record as a fallback because it covered off several eventualities, not just related to the lack of an MCP card. I think in many respects it was to help alleviate some of the workload on our IT sector, who have really been working very hard on things like the vaccine passport, on the booking system for COVID vaccine, for flu vaccine, and a whole variety of other things. So it was really to have a reliable fallback system that everyone could easily understand. Your vaccine record is what you need.
And I want to ask about the medical exemption. You mentioned, because originally when this rolled out, people were told they'd get a QR code. You're now saying that's not until about a month away. By showing the letter, doesn't this now mean that people have to reveal personal health information to businesses when they walk in, because people will know that they have one of these two conditions that you just talked about, as opposed to the QR code, which would in fact maintain that anonymity?
You make a very good point, and that's why the QR code was the way we went in the first place, which is that it protects your personal information and only reveals what is absolutely necessary. Your own vaccine record for people in this province, for example, gives out more personal health information than is necessary, and that is a fallback to allow you to access the services until such time as the QR code comes. For those people with a medical exemption, the form simply states that they meet the criteria. So it doesn't specify what particular reason. And so, again, it's a compromise, and people always have the choice of not showing that, should that be the case. If it is shown, certainly in a government organisation, then there is an expectation, and a reasonable expectation on their behalf, of privacy.
We will now go to the phones. Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi. It would seem that the College of Physicians and Surgeons policy is changing on the fly. Although they only listed those two conditions you mentioned before, it seems their policy has now changed. They use those as examples, but now also say that a condition that is considered valid by specialists in the field can also be presented, and that the backup research of some kind has to be given along with the notice of the exemption. So is it really a clear path as to how these forms and letters are submitted, where they're submitted to? We were hearing that a lot of the doctors aren't even sure what they're supposed to do.
Certainly from our point of view, the path as to where the paperwork goes and what process the QR code is generated by, those are clear internally. The issue that you raise about the change in criteria for guidelines is one better addressed to the college. They, in law, set standards of practice for physicians, and they will be better placed to comment on why they felt they needed to expand or change the guidelines. I can't speak for them.
I've already spoken with them. The question is, wouldn't the people overseeing this in the Department of Health or in the health authorities be unaware that these two conditions are not necessarily the only two?
We don't oversee the College of Physicians and Surgeons. They're a standalone body, Peter. They set standards for clinical practice in the practice of medicine.
No, I realize that. I'm asking the people who oversee the vaccine passport would need to be aware of what the college is actually saying.
Certainly, we would like to be on the same page. From our point of view, the appropriate filling in of the form, simply stating that they meet the criteria for an exemption, is all that we will require in order to process the request for a QR code along with the letter, as I've stated. So we're not second-guessing the college, we're not second-guessing the clinicians, we're just simply making sure that the paperwork is there. Whether or not they've gone through a due process to get that letter or form, I would certainly hope so, but that again is a college issue, not a government issue.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Minister Haggie, I believe in your preamble you mentioned that a mental health piece is being considered under medical exemptions. I was just wondering if you can expand on that and what types of scenarios are being considered.
It's at a simple stage. We have asked, or will be asking the college through our medical consultant to state one way or another if and what mental health conditions might be applicable for an exemption, so that family doctors, nurse practitioners, specialists would be in a position to appropriately fill in exemption forms if asked to do so. Those discussions are at a very preliminary stage at the moment, but we will be asking for something as soon as the college can do that.
And Dr. Sevier, you mentioned that preparation is underway for the vaccination process for kids aged 5 to 11 when that is approved. I know that some jurisdictions are setting up a pre-registration system for kids in that age group. Is the province looking at something similar?
I can't really comment on that. I think that's all the planning is now ongoing at the province and with the regional health authorities, and I can't comment to that level of detail at the moment.
If I may, Richard, what we had envisaged with school-age children was a program similar to that was offered for flu shots last year, whereby vaccinations could actually be offered in schools. That's kind of like a captive audience, and it would solve the pre-registration problem. The RHAs would do it in the same way with flu. So that's certainly an operational consideration that we're actively looking at the moment, and might avoid setting up yet another online portal or pre-registration system.
Thank you.
I will now go back to Reach Reporter to see if you have one final question. Jody Cook with NTV, do you have a final question?
On the booster shot issue, we've been hearing from people who were in the very first round of getting vaccinations, which would have brought us back to, I guess, March, if I go off the top of my head, who might be concerned that their immunity is waning now because we're so far along here. I do know that some healthcare professionals have received their third shot. Is there still conversation around this, and is there anything that you want to indicate to those who might be fearful that their immunity is waning?
Yeah, so there's a couple of things. One thing is that for the sort of general population who receive their vaccine 2 months apart, we know that those 8 weeks is a good interval, and that we're seeing a less waning of immunity if you have those intervals, between your first and second dose. So that's a good thing for us here in Newfoundland, where we kept to generally that interval. And those who were early on and are now coming up to sort of 6 months or a bit longer past their second dose, what's happening is NACI is coming out with recommendations at the end of this month, and we'll be following those recommendations. And they'll be looking at the next group of for priority for boosters. We have started, as you know, the boosters in long-term care and congregate living settings, because that is reflected in our data where, across the country where there are concerns. We've done well in terms of that. I think, for example, in the personal care home that I've spoken to at other media briefings, their vaccination was later. So, and even this booster dose for those groups will be 6 months after the second dose. That's where we get the biggest bang for our buck. And but certainly to those people, I would say that is coming. And NACI will be making recommendations at the end of the month or just before the end of the month.
Peter Cowan with CBC. Do you have a final question?
Yes, and this is about people whose vaccine records are have some errors in it. A lot of people I've heard from have submitted to the email address or called the number, are still waiting to hear back. I'm wondering, do you have a sense of how big is the backlog in terms of how many are they dealing with? And what would you say to people who are now nervous about not having that QR code come Friday, even though they are fully vaccinated?
Thanks, Peter. I'd take the last bit first. I mean, your vaccine record is your safety net there, and we've discussed that. In terms of the backlog and how long the wait is, I have anecdotally heard people get their health record corrected in Central Health, for example, in a period of 48 hours. I will go back and see if I can find you an order of magnitude, at least, about backlog and some kind of expected wait time, but I don't have those figures to hand.
Peter Jackson with the Telegram. Do you have a final question?
Yes, regarding backlogs, the MCP numbers, the confusion over medical exemption, isn't it fair to say that there was not enough advanced planning that went into these passports?
I would, I think, take issue with that statement. I think the planning that went into it was proportionate to the size of the task ahead of us. I think what it has shown to us is that there's very much a laissez-faire attitude about MCP cards, quite frankly. And that's the other end of the pendulum from where, when the expiry date was introduced some 15 years ago, we actually had 780,000 active MCP cards, which was also an error in the wrong direction. So I think we've been conscious that there are people who have let their cards lapse in numbers that we maybe didn't appreciate. We have extra resources added at MCP offices to deal with that. And as I say, the safety net is always your after vaccination record card, or your a card that you got from your regional health authority or your vaccine provider. That is acceptable proof pending the arrival of a QR code. So that is available, and that is in your possession now, and that's ahead of the deadline.
Thank you.
Richard Duggan, VOCM. Do you have a final question?
Yes, I do. Earlier, Dr. Sevier, you mentioned the flu season and the vaccination campaign that is going to be launched for that. Is there any data out there that you can speak to about, for those that are unvaccinated, how influenza interacts with the Delta variant and how concerning that would be for you?
I don't have any specific data with influenza and the Delta variant. I know last year we were quite concerned about the interaction between the variant that was, or what was circulating then, and influenza, and because the people that are susceptible to both influenza and COVID, often it's the same group. Those with comorbidities, or those who are quite elderly, those in congregate living situations. So we were quite concerned about the combination of the two. And we also had questions about what that might look like. With we suspected that would result in much more severe illness for both things, because both are respiratory viruses. So if somebody had both, so we were really that's why last year we talked lots about how important it was to protect yourself with flu vaccination, and I think it just points to, you know, what I guess since the 5 weeks I've been covering Dr. Fitzgerald, just how important vaccination is. I mean, it still amazes me that here we are just a year and a half later, and there's brilliant minds in research and development across the world that have developed a vaccine that now, to me, COVID-19 is becoming a vaccine-preventable illness, and that's truly a wonderful thing, and why I think it's so important for people to take advantage of that. I still remember when I first graduated as a young physician, when Haemophilus influenza B, vaccination came out sort of around or after the time I graduated. So things I saw and illnesses I saw as a student suddenly were disappearing. And for me as a young physician, this really, showed me I wasn't around in the times of measles, mumps, or things like that. Just how important vaccination was, and I could see it in my practice, the impact it had. So I guess that's that has added to my belief in the power of vaccination. And so that's my final word on that.
Thank you, everyone. Minister, do you have any final comments for today?
Yes, just really to clue up. Thanks again to Dr. Sevier. If anything, the message still is vaccines work. Get the shot, look after yourself, look after your family and your friends and community. So thank you very much for your time. And as Dr. Fitzgerald would say, hold fast and stay safe.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.